Typically, when you're watching my screencasts or even when it's a video session like this, something you don't see is this, that I'm wearing wrist braces, and that's been going on for a little while. As in, these are some of my past ones, including a pair that I made myself, which worked nicely because I didn't have to roll up my cuffs like this to keep them out of the way. I could actually put the sleeves down over them. But the technology's come a long way in that time, and the main thing, if we look at this current one, there's just a little piece of metal or plastic or something in here that keeps your hand at a certain angle. And the reason I do this is that I have a little bit of numbness going on this thing. I can feel a loss of sensation there as I run my finger over it, and this loss of sensation, I can feel more and more of it as I get towards my thumb. Now, I did actually start losing a little bit in the thumb as well, which is bad. There are two nerves that run through this part of your hand. These are the carpal bones, and they generally form a U shape that you've got tendons and nerves and such going through, and across the top of that U there's a ligament holding things together, and so that is called the carpal tunnel. And when things get inflamed, when there's too much friction because you're doing a lot of the same motion rapidly over and over again, you know, from typing or texting, then things can start to get ugly, where you're actually, those tendons are working like a saw almost. They're cutting through the outer sheath of the nerve, and that's when you start to feel the tingling, the loss of sensation, and you want to shake your hands. And this can snowball pretty rapidly. You find yourself waking up at night and you're curling up your arms, and just the act of curling them up actually aggravates the situation. You need to learn to sleep with them straight. And again, this is where sometimes people start wearing their wrist braces to bed. Lots of old people stuff going on here. Sorry, but if someone had told me when I was younger, then I could have avoided a lot of trouble. And there is surgery for this, but it is not 100% effective. It's very much a case-by-case basis, and I'm going to tell you about I am telling you about what's going on with my hands. Everybody's different, so this is not textbook. This is just some real-life empirical experience. What you want to do, and I'm not a medical professional. I've picked up a number of things from professional resources, but you need to consult with a doctor if you're having this problem to get the best advice, to get the best information. And of course, you can, search on the web for other things. In fact, I encourage you to. A lot of people have been able to really alleviate their symptoms through a number of different means. One thing that you can do, and just try this, is look for, if you take, I'm just clamping on here, and with my thumb, I can find there's a muscle in there that is just a thick cord, and it rolls underneath as I push down on it. So I try to get it in a good spot and just really pinch on it. And what I'm doing, it's kind of like when you put a blood pressure cuff on, how it doesn't let the blood in and the pressure builds up. And what we want to do is make sure that the blood is flowing properly through all of this. So I let it build up a little bit, and then I let it go. And I can already feel a difference in sensation going down through this finger. And you can just take and work on this every now and then. I'm just, like I said, I'm just holding in some pressure there. And after it's built up, count to, say, 30. Let it through. And again, you can feel that. Something that's a little, that's also good is just putting your palms together, and you want to keep the heels together as best as possible. This isn't going to work as well. So if you can kind of do a Buddha thing here, and just try to make 90-degree angles. Not if it hurts. Don't do anything, any of this. Don't do it if it hurts. So it's taken me some practice to get to this point. Some people who are more flexible can probably go a lot further. But anyway, so do that. And every time you're doing this kind of thing, you just want to shake it out. You want to get everything loose. And another move you can do, I'm just going to put my hand out straight, and lock your elbow, put your hand up as close to vertical as you can, and I'm bringing in this other hand, and I'm just going to pull back on there a little bit, and you should feel something probably right around here, and just trying to release some of the tension that gets built up. Muscles have two jobs. They clench and they release, and they don't always remember to do that release part. So we're helping them with that. And after you've got it there and it doesn't feel like it's going any further, and again, not so it hurts, just nice and easy, I just take and do each finger individually, and then thumb, which sometimes pops like that. Actually, it's pretty common for me. And then I do the same thing with the other arm. And I'll speed it up a little bit, keep it on internet time. Yep. Okay, so shake it out again, and now I'm going to make a fist, just really loose, and I'm going to stick the thumb from my other hand in there. Okay, let me show that right. So there's a fist, stick the thumb into the gap, and again I'm locking my elbow straight, and I'm just going to bend that down in the other direction now. And wait. And then I'll switch. Okay, so there you go. About once an hour. There are rules for this, and human body wasn't developed for the cubicle. The cubicle was supposedly developed for the human body, but we're still trying to figure out how to make that more effective. Standing desks are one good thing that are starting to come along. I've used those. Well, wasn't so much a standing desk as a bunch of boxes, but it worked. Anyway, so at least once an hour is the point I'm getting to. You just want to take and stretch, stand up out of your chair. I won't do that because I'll go out of frame. But just move around and use the technology to your advantage. Set yourself a reminder that tells you, hey, it's time to get out of the chair just for a minute, because there are all kinds of really bad things that can happen when you're sedentary, when you're sitting too long. In fact, that's one of the real motivators behind standing desks is, statistically, the more you sit every day, the sooner you will die. And I don't like that because I have a sedentary job, but it's the reality. Even if you get out and you run and you exercise, so many hours a week, the more you sit, the worse off you are. So, and you don't have to stand the whole time at a standing desk. Ideally, you get a situation where you can stand for a while, and when you inevitably get tired, you can sit and continue to function. So, everybody has to kind of find their own solution to that. It might be a desk that just telescopes vertically very easily, or whatever. But this is your medical minute. It's running about 10 minutes. So Be safe, take care of yourself, because damage accumulates. It doesn't go away for the most part. It just keeps building up over time, and then you get old and decrepit like me. Alright? Take care.